Well, I think telemedicine is a field that has been developing in the last few years. We are now at a stage, I think, that there is ample clinical proof that it works, that it can help reducing morbidity and mortality. But now we are at a stage that there are other problems like legal problems, cost problems, who will pay for it, etc. And that's a bit the stage where we are now. Well, the most typical are heart failure patients. For this we have studies already dating back for 7, 8, 9 years, showing that measuring on a regular basis and transmitting data such as blood pressure, weight, etc. helps in reducing morbidity and mortality. We've done such a study in 8 Belgian centers around the country, and we could show that the mortality was decreased by more than 50%. So it has a very important clinical impact. And now what we did recently is look at the cost. If we reduce hospitalization, then cost goes down, and that's where we could see that there's also good news to come. The idea in heart failure is that it is a way to predict and to prevent rehospitalization. You know, severe heart failure patients come into the hospital every few months. They are rehospitalized at a very high rate, and this costs a lot to the society and decreases quality of life. And by measuring themselves and transmitting these data, we can predict or try to predict decompensation. And at that moment, if we intervene before the situation gets too bad, we can decrease hospitalization. Well, it depends on the way we do it and on the population you target. I think, in my view, it has to be very severe patients with recent decompensation. They leave the hospital in a not very stable situation. That's the good population, and we have done our study over 6 months. I think maybe 1 year of monitoring might be enough in this kind of population, and then you see significant decreases. A very recent Cochrane analysis showed also that there is, over all the different published studies, there is a significant influence of telemonitoring on mortality morbidity. The technology involved is very simple. It's a scale, a blood pressure device, Bluetooth, a cell phone and a server. That's about it. A busy practitioner will not have the time to look up all his patients every day. So what you have to have is a heart failure clinic, an organization with a heart failure nurse, dedicated and educated, that can react to the alerts. In our hospital, the heart failure nurse has some standing orders, knowing what she can do in case of changes in the parameters, and we discuss it once a week to see, okay, is there any changes we still have to make. And the advantage also of telemonitoring is that you can work together, for example, with the general practitioner. What we showed in our study is that the GP can be the first to react to an alert, and we can sort of look over his shoulder, check. The heart failure nurse would check 2 or 3 days later, okay, is it going better after the change of therapy? And that way, I think this collaboration proved to be very effective. The cost at this moment is hard to say, because it is mainly personnel cost. We work with simple material scales and all that. It's not much, and the transmission of the data is not very much to pay for. So the main investment is the heart failure nurse. And at this moment, for each patient, we had an involvement, if I remember well, of 1 hour of cardiologist per 6 months, so it's not much, but 1 hour per month per patient for the heart failure nurse, and that's what you have to calculate into the cost of the system. But of course, in some cases, you see the patient more often because you prevent them from getting into the hospital. So in the balance, it will be more or less the same. And I don't feel that I have less work to do now than I did before, but you see the right patients. What we normally do with these severe patients is we see them in the heart failure clinic every 3 months, but they decompensate in between. So you see them when they're stable, and you don't see them 2 weeks later when they are not doing well. So it's, I think, more efficient in the way that you target the right patients at the right moment.